It starts with a whisper, a feeling that something is just off. You ignore it, blaming stress, a bad meal, or just getting older. But what if your body is trying to send you a life-saving message? What if these are the first, faint signals of pancreatic cancer? This disease is often called a silent killer because its early signs are so easy to dismiss. But silence doesn't mean absence. It means we have to listen more closely. I'm Dr. James, and here on our channel, Pancreatic Cancer Warriors, we believe that knowledge is your first line of defense. Today, we're going to uncover the 7 critical early symptoms that demand your attention. Ignoring them could be the difference between life and death. And please, stay with me until the very end. The last symptom I'll share is one that even medical professionals can overlook, but it could be the one clue that saves your life. Many of the earliest symptoms are frustratingly vague, acting more like quiet imposters than loud alarms. This is precisely why pancreatic cancer is so notoriously difficult to detect in its initial, most treatable stages. You might notice a subtle shift in your appetite. It's not that you feel sick, it's just that you feel full much faster than usual. That large meal you once enjoyed now seems daunting, and you're pushing the plate away after only a few bites. Or maybe you develop a new, unexplainable aversion to certain foods, especially rich, fatty ones. These aren't dramatic changes, but they are persistent. Alongside this, your digestion might feel off. You could experience a nagging, low-grade indigestion that doesn't seem to respond to or a gentle but constant bloating that makes you feel perpetually uncomfortable. It's the kind of symptom you might mention in passing to a friend, only to have it dismissed as just one of those things. But your body knows better. These small, seemingly disconnected changes in your appetite and digestion can be the pancreas struggling to produce the enzymes needed for proper digestion. It's not a 5-alarm fire. It's a slow, quiet malfunction that you must not ignore. Pain is one of the body's most direct forms of communication, but the pain associated with early pancreatic cancer is a master of disguise. It often begins not in your belly, but in your back. You might feel a dull, gnawing ache in your mid-back, a pain that seems to bore deep inside. You might blame it on a bad night's sleep, your office chair, or that time you lifted a heavy box. The pain might come and go, but it has a persistent quality, often worsening when you lie down and feeling slightly better when you lean forward. Then, over time, this mysterious back pain can start to radiate. You begin to feel it wrapping around your sides, eventually settling into your upper abdomen, just below the breastbone. It's not the sharp stabbing pain of a gallbladder attack. Instead, it's a deep, constant ache. Imagine a heavy weight pressing down from the inside. This specific pattern pain that starts in the back and migrates to the abdomen is a classic sign. It occurs as a growing tumor on the pancreas begins to press on surrounding nerves and organs. If you're trying to connect the dots between an aching back and a stomach that feels perpetually sore, you're not imagining it. You are picking up on a critical clue. Now, let's talk about 2 symptoms that should set off immediate alarm bells: unexpected weight loss and profound fatigue. When we talk about weight loss, we aren't referring to the few pounds you shed after a week of healthy eating. We are talking about a significant, unintentional drop in your weight. The scale is going down, week after week, even though your diet and exercise habits haven't changed. Your clothes feel looser, and people might even compliment you. But you know this isn't right. This happens because the cancer is consuming your body's energy reserves and interfering with its ability to absorb nutrients. Hand in hand with this is a level of fatigue that is bone deep and relentless. It's not the normal tiredness you feel after a long day. It's an overwhelming exhaustion that sleep doesn't fix. Waking up feels just as hard as going to bed. The energy to do simple things, like walk to the mailbox or have a conversation, is gone. It feels like you're constantly walking through thick mud, and your body's battery is always at 1%. This isn't just being tired, it's a cellular exhaustion. Your body is fighting a hidden war, and it is draining all of your resources. If you are losing weight without trying and are too tired to function, your body is screaming for help. One of the most specific signs of pancreatic trouble is jaundice, but it doesn't always appear as a dramatic full-body yellowing. In its earliest stages, it can be incredibly subtle. The first place you might notice it is in the whites of your eyes. They may take on a faint, slightly yellowish tinge. You might only notice it in certain lighting or when you look closely in the mirror. It's easy to dismiss as a trick of the light or a sign of being tired. As it progresses, your skin may start to develop a sallow, yellow hue. It's often mistaken for a fading tan or a sign of being unwell. but this yellowing is a direct result of a blockage in the bile duct. The pancreas is located right next to this duct, and a tumor, even a small one, can press on it, preventing bile from flowing from the liver to the intestines. This causes bilirubin, a yellow substance in bile, to build up in your bloodstream and deposit in your skin and eyes. Jaundice is never normal. Even the slightest hint of yellow in your eyes or skin warrants an immediate conversation with your doctor. Don't wait for it to become obvious. Investigate it when it's just a suspicion. Your bathroom habits can offer some of the most direct and reliable clues about your pancreatic health. It's a topic people are often hesitant to discuss, but paying attention is crucial. One of the key signs is a change in the color of your stools. If the bile duct is blocked, bile can't reach the intestines to help digest fat and give stool its normal brown color. As a result, your stools may become pale, clay-colored, or grayish. They may also appear greasy and float, a condition known as steatorrhea. This is a sign that your body is not absorbing fat properly. At the same time, because the bilirubin that would normally be excreted in your stool is being redirected into your bloodstream, your kidneys work overtime to filter it out. This can cause your urine to become noticeably darker. It may look dark, brown, amber, or even the color of cola. You might think you're just dehydrated, but if drinking more water doesn't lighten the color, and it's combined with lighter than usual stools, this is a powerful indicator that something is wrong with your pancreas or bile duct system. These two signs together paint a clear picture of a specific internal problem. Early detection is not just a catchphrase. It is the single most powerful weapon we have against pancreatic cancer. The 5-year survival rate for this disease is tragically low, but that statistic is heavily skewed by late-stage diagnosis. When pancreatic cancer is caught in its earliest stages, before it has spread, the potential for successful treatment, including surgery, increases exponentially. Your chances of survival can be 10 times higher. This is why every single symptom we've discussed matters so profoundly. Every whisper, every ache, every subtle change is a potential head start. You are the #1 expert on your own body. You know what is normal for you. Trust that instinct. The goal of channels like Pancreatic Cancer Warriors is to empower you, to turn your fear into action, and to give you the knowledge you need to be your own best advocate. Paying attention isn't paranoia, it's proactive self-care. It's giving yourself the best possible chance to live a long, healthy life. Your awareness is your armor in this fight. Thank you for staying with me. The one symptom that is often overlooked, even by doctors, isn't a pain or a visible change. It's a sudden, unexplained onset of diabetes, particularly in someone over the age of 50 who is not overweight and has no family history of the disease. Or, if you already have well-controlled diabetes, it might be a sudden, dramatic difficulty in managing your blood sugar levels. Why does this happen? The pancreas produces insulin, the hormone that regulates blood sugar. A cancerous tumor can damage the insulin-producing cells or cause widespread inflammation that leads to insulin resistance. A new diabetes diagnosis is often treated as just that, diabetes. The connection to the pancreas is missed. So, if you or a loved one suddenly develops high blood sugar with no clear risk factors, you must insist on a deeper investigation. Ask your doctor, could this be related to my pancreas? It's a question that can be uncomfortable to ask, but it is a question that could absolutely save your life. Remember, you are your own greatest health advocate. Listen to your body's whispers before they become screams. Stay vigilant, stay informed, and never ever give up hope.